Hello, I'm Padmaja Joshi and welcome to our special dialogue series, Savlon Swasth India Mission presents Hygiene Sahi to Health Sahi, partnered by Times Network. The pandemic, as everyone would agree, has brought into sharp focus the fact that collective health of the country is rooted in everyday citizens taking responsibility for their individual hygiene. This is our inaugural episode, and in it, we'll try and do a deep dive into hygiene, the roadmap to a healthier India. I'm in conversation with a distinguished panel, which includes Sanjeev Puri, Chairman and Managing Director of ITC, Amitabh Kant, CEO of Niti Aayog, Nainalal Kidwai, Chair of the India Sanitation Coalition, Chairman of Nephron Clinics, Dr. Sanjeev Bagai, and Dr. Naresh Trehan, Chairman and Managing Director, Medanta, the Medicity. Now, this is a subject that is critical. It draws diverse range of opinion. So to all our viewers, I ask that you stay connected with us via social media through the course of this program, and you can join in with your comments, queries. All that you have to do is use the hashtag Hygiene Sahi to Health Sahi. Now, let me get started with you, Mr. Kant. The pandemic's silver lining, if we can call it that, is that it has created a behavioral change when it comes to health and hygiene. We see people now desisting from spitting. They are more conscious about wearing a mask or washing their hands. How can a post-pandemic India embrace a long-term roadmap to retaining these healthy habits?
Firstly, the pandemic has highlighted that we must follow our traditional methods taught to us in school post the discovery of germ theory. Washing hands regularly, keeping our surroundings and environment clean, disposing of garbage in an appropriate manner, maintaining personal hygiene, all these are very critical. These simple habits play a very major role in maintaining the health of families and the health of society. Even in workplaces, organizations must ensure that they provide safe and clean working environment to enhance productivity while maintaining health and hygiene of their employees. During COVID-19 pandemic, people were instructed to work from home if they had symptoms of cold or flu. These instructions must be strictly followed and social distancing measures must be carried out to avoid spread of any infection in workplaces. And I would request everyone that protocols such as wearing of masks, regular sanitization and disinfection of workplaces, social distancing must be followed very, very diligently throughout. This is really the key.
Okay, Mr. Puri, what was the motivation behind the inception of the Savlon Swasth India mission?
So ITC as an enterprise has always believed that as large economic organs of society, enterprises must serve a larger societal purpose. And that's captured in our credo of nation first, sab saath padhe. Reflecting this ethos, Savlon purpose is healthier kids, stronger India. So it seeks to promote and take forward this message through the Savlon Swasth India mission. And we commenced the journey in 2016. Realizing that the fundamental requirement is to orchestrate behavior change. That's the first and critical step. So we began with an outreach program across schools. And so far, prior to the pandemic, we had reached nearly over 16,000 schools, nearly 6 million students were kind of engaged in the program. And we were continuing this journey till, of course, we came into 2020 and the world faced this crisis of the pandemic. So every brand has to evolve with the changing times. So the brand too evolved and went beyond hand washing to deal with the issues of masking, for example, and also brought to the consumers some additional products that help the consumers find the pandemic, made available a lot of hygiene kits across many locations, many states, many hospitals, provided enormous amount of sanitation facilities at the Kumbh Mela, for example. And that's been really the journey. Now that, schools are beginning to open, now that also incidentally, we are also seeing a rising wave of cases. So it's important for us to reinforce the message, to amplify the message. And that's why we thought that let's have another leg to our journey and our commitment to create healthier kids and a stronger India.
Absolutely. And as I said, children learn by example. Should access to hand washing and sanitizing facilities become a norm in schools? Since we are also conducting a tweet-a-thon to accompany this telecast, please feel free to join in with your thoughts using the hashtag Hygiene Sahi to Health Sahi. And please don't forget to tag Savlon India and Times Now onto your tweets. But if I can come to you now, Dr. Bagai, broadly speaking, what do studies indicate about how closely tied personal health is to community health? Is protecting oneself truly protecting India?
There are a huge amount of studies for the last many decades which have established personal hygiene, home hygiene to have a direct correlation to decrease communicable and non-communicable diseases which impacts immediate community health, be it decrease in incidence of hepatitis A, hepatitis E, typhoid, Shigella, Salmonella, and a host of communicable water and foodborne diseases, hand hygiene to include food and waterborne diseases, skin hygiene, oral hygiene. Oral health is another hugely neglected aspect, not only in children, but even in adults. There are studies dating back from almost 1960s that personal health and hygiene has a direct impact in those days to decrease the impact of rheumatic heart disease, which is caused by streptococcal infection, which are common sore throats. Now, the huge aspect is of viruses. So personal hygiene, be it skin, be it nails, be it hands, be it oral, be it eyes, be it an overall clothing hygiene, and will have an impact on decreasing the spread of communicable diseases and infectious diseases such as viruses, what we are seeing in COVID. And one person in a community carrying an infection, especially if it's communicable or it's infectious or it's transmissible, can infect the entire community. So the health is never a state subject or a national subject. It's an individual subject. It's a choice you make. It's a family which inculcates the habits to young children, which initiates adolescent good health and then finally into adulthood good health.
Now, Ms. Al-Kidwai, the pandemic has taught us that health has no calendar, that best practices need to be followed irrespective of season, festival, or time of year. How can we encourage the public exercise this discipline required? How can we make good health and hygiene second nature for everyone?
So I have no doubt that the level of sanitizing and hand washing is higher than pre-COVID. Yes, it may have fallen away a bit. You're right that, we've let our guard down, but it's not, the habit hasn't gone away completely. And the need to do it is there. It's there in every place, public place you step into. There's a sanitizer there. People are sprinkling stuff on you. All of this is a very new India. But, I just want to touch on an area to do with sanitation, given the work I do through the India Sanitation Coalition, and where companies like ITC are a very critical part. What we have, of course, worked in is more to do with toilet habits and keeping toilets clean and ensuring the treatment of what goes into the toilet is dealt with, because all of this also helps to create a hygienic environment. And dare I say, if the Swachh Bharat mission had not become as active as it had, it's quite possible that COVID would have been far more disastrous for us as a nation. I was looking at some of the studies that have emerged, and one of them suggests that from the period of 2014 to 19, there's a WHO report, in fact, which has estimated that through the work of sanitation, we have saved more than 3 lakh lives, according to that report. And that was till 2019. So it's only become better, I would imagine, over the last couple of years. There's a BMGF assessment, which again is an old assessment up to 2017. So just the first 2-3 years of Swachh Bharat. which said that 32% lower cases of diarrhea among children was reported in ODF areas. And diarrhea is directly related to hygiene and hygienic habits. So our parents washing hands, our kids being kept clean, is the environment clean, 32% lower cases, and 15% lower cases of stunting. So stunting is where a child does not grow to its full potential. Even the brain doesn't develop to the full potential. So the direct connection between hygiene, health, safety, and nourishment and the growth of a child are very, very linked. So I think when we look at hygiene and hygienic habits, it's not just the washing of hands. It is everything to do with good behavior, good toilet behavior, having the right environment and a clean place where we can work. And there's a related concept, and that would be that we found in the UNICEF report, again from a couple of years ago, that ODF, that's open defecation free villages, had 11.25 times less groundwater contamination and 2.16 times less contaminated food, 2.48 times less drinking water contamination. So contamination at every point through clean habits, clean toilet habits, also helps in the hygiene that we see in the environment in which we live. So many aspects to this. And I really believe India has made a step change over the last 5-6 years in terms of the way we are addressing hygiene.
So we're asking you, do you think that wearing a mask is still required in public spaces, or that we can now do without it? Since we're also conducting a tweet-a-thon to accompany this telecast, please join in with your thoughts using the hashtag Hygiene Sahi to Health Sahi, and you can tag Savlon India and Times Now on your tweets. Dr. Tiran, what's your take on this? Would you advocate masks forever?
See, we are using antibody count as one of the indicators of immunity. If you go by that, then a large number of people, after 6 months, their antibodies are actually diminishing. और ये एहसास हुआ भी है लोगों को, पर ये एक चीज होती है कि मेमोरी बड़ी शॉर्ट होती है. पर लोगों ने, क्योंकि ये जो विंडो आई जिसमें केसेस कम हो रहे थे, कम होते जा रहे हैं, तो लोगों को भी ये फीलिंग हुई कि हम तंग आ गए हैं मास्क पहन के. आज के दिन अगर जो हम नहीं इस पे प्रिकॉशन लेंगे तो हमें, जैसे मैंने बोला पहले भी, कि बहुत महंगा पड़ सकता है, बहुत हावी हो सकता है हमारे ऊपर. एक वायरस के दो पहलू होते हैं, एक कि वो कितनी जल्दी फैलेगा, और दूसरा अगर जो फैलेगा तो जिन लोगों को लगेगा उनके लिए कितना खतरनाक होगा. सो ये जो हम ओमिक्रॉन की बातें कर रहे हैं, जो अभी साउथ अफ्रीका में डिस्कवरी हुई, उसकी जेनोमिक सीक्वेंसेस वहां हुई, इस ओमिक्रॉन की जो अंदाजा लगाया जा रहा है कि वो कोई 18 से 20 टाइम्स पावरफुल है. तो अभी इसीलिए हम ये सोच रहे हैं कि इसको कैसे कंटेन किया जाए, क्योंकि असली अगर जो हमने इससे लड़ना है तो इसको इसी स्टेज में हम अगर जो कंटेन कर सके तो हिंदुस्तान बच सकता है. अब उसके क्या साधन है, उस पर चर्चा हो रही है.
In desperate circumstances, like in the midst of a pandemic, perhaps you go beyond the stick and you basically give the gloom and doom messaging. That's perhaps the only way people eventually get themselves to mask distance and sanitize. Coming to you, Amitabh Kant, how can we change the tonality of health and hygiene messaging from information overload to inspiring in nature? That we have to tell people this is something that you should be doing on your own. It shouldn't require enforcement by law or coercion.
So during COVID-19 pandemic, civil society organizations and NGOs were urged to sensitize people to follow COVID-appropriate behavior and get vaccinated. A massive mask awareness campaign in 11 languages was made available at indiafightscovid.com, and information was disseminated across the length and breadth of the country. Nothing can be more inspiring than seeing the Prime Minister of the country follow hygiene and COVID-appropriate behavior. The fact that our Prime Minister was amongst the first to get vaccinated is itself inspiring. And hygiene has been the focus of the government since 2014, when the Prime Minister launched the Swachh Bharat mission. The objective of the mission, including eradication and manual scavenging, generating awareness, and bringing about a behavioral change regarding sanitation practices and augmentation of capacity at the local level, has been very, very unique.
Would you like to weigh in on this, Mr. Puri?
Communication is certainly very important. Building a sense of national pride certainly is important. So really the question is, how do you do it? And is it merely the role of government? I think it's not merely the role of government. It's an enormous challenge, and every organ of society needs to do its bit, whether it's civil society, NGOs, whether it is corporates. So everybody has to do its bit. So to share an example, and we do a lot of work in rural India. This is part of our social development initiative. So for example, when we construct household toilets or community toilets, so we put in a lot of effort to engage with the community. And it's interesting to note there that the ladies in the community are more open to the change, and they embrace the change faster. They become ambassadors of the change. A similar example in schools. You see, when we go to schools, now sometimes schools do not have washroom for ladies. Sometimes the washrooms are there, but are not in a position to be used, or even hand washing facilities are not well equipped. So it's not about just helping correct the infrastructure, but it's also about how the change is to be sustained and how the infrastructure is to be sustained. So you have to communicate, you have to also set some institutional mechanisms in the community so that the effort is sustained. And just to give you some data and to also address the question that you asked earlier about the connection between hygiene and health. So in our surveys, what we found is that 95% of people wash their hands after defecation and before meals. And nearly 90% of children also do so. And in another question, in the same area, 89% of the households reported that diarrhea for children less than 3 years was not experienced after toilets were constructed and after this hand washing habit came in. So that's some local data point to show the impact of these initiatives.
And I think here the corporate sector is amazing in terms of what it does. What we don't do well enough is replication of success. So, I would love to see, and that is one of the roles we would like to play at the coalition, is something that is succeeded in terms of, say, a district that ITC has adopted and shown success. Can we not offer this as a product across the board to anyone and everyone who wants to or is able to adopt it? So replication of best example is something that we don't have to go abroad to see. We have these pockets of great examples that have been happening, and sometimes at the hands of government, often at the hands of the private sector and the corporate sector. So let's look at showcasing these and making sure that we can go ahead with it.
What do you, the viewer, think about this? Do you think that children need to be taught the importance of hand washing and sanitizing in schools as well, or is it enough to just teach them at home? We're conducting a tweetathon to accompany this telecast, so please chime in with your thoughts using the hashtag Hygiene Sahi to Health Sahi. Just don't forget to tag Savlon India on it, as well as Times Now. While we broadly understand the importance of becoming a healthier nation, what are the tangible metrics and parameters that we need to take a closer look at to assess our progress? What do you think about this, Dr. Bagai?
There are two parts to your question. One is, of course, the initiatives which are taken, and second is the end result. So I think health per se, right from school days, must be incentivized. Good health should be incentivized. The entire curriculum needs to be monitored. There has to be an inculcation and interplay and interactions with the parents, again, which can be quantified. There needs more public awareness messages, more health talks to the parents and the children right from middle school days and younger school days going up to high school. With regards the monitoring aspects, I think each and every physical parameter of every individual in a school is measurable. And I think early intervention plays a huge role. When you talk in terms of good hygiene practices and good health, which is preventable, so we are moving away from the so-called affordable, accreditable, and accessible healthcare. It has to become personal healthcare, preventable healthcare, predictive healthcare, proactive healthcare.
Now, remember, for hygiene in homes, do you believe that just cleaning is enough, or we need to regularly disinfect as well? As mentioned earlier, we are conducting a tweetathon to accompany this telecast, so you can join in with your thoughts. All you have to do is tag Savlon India and Times Now and use the hashtag Hygiene Sahi to Health Sahi. Ms. Nana Al-Kidwai, does current health and hygiene messaging from public and private sector resonate with everyday people? What needs to change?
So, the messages have to be really cast into different types of messaging, very localized at times. And I fully agree with Sanjeev that starting with women, but bringing children into some of the execution is absolutely the way to go. The ownership is there. And for every program that was instituted, it's not enough to just have the government drive it. We need the NGOs and the private sector in there to continue the programs. And the ones that work best are where there is a tripartite arrangement between government, yes, the execution partner, who's either private sector or NGO, and the community. Because that's the only way the program sustains. Otherwise, it's just one burst of messaging, one burst of toilet making, and people go back to old habits. Toilets go back to becoming storerooms, etc. So it's ongoing in nature, and community coming together to make sure that it works, that there's accountability, that every action that is taken is followed through is very, very critical. And where the program has worked best is where this has happened. I think there's a second area which has been very important because one of the things we found is to look at the whole area of hygiene and sanitation through gender lens, so that you test every program to see where are the women in this? Where can they be used? How are they the beneficiaries? So they are not the only, but you just make sure that the messaging you have is also messaging which doesn't go against their interest. So you have to, always modify this message around how the community as a whole engages, but using women as center stage to execute, and also keeping in mind that it is critical for their well-being in every aspect to ensure that it's there. Children have been amazing. Schools are a great way of galvanizing interest. I love the idea of these child cabinets. I'm aware of what ITC has been doing there, and the outcomes are excellent. So what we need is really using these forces of communication and making everyone at the end of the day accountable for taking the programs forward. My biggest worry is that for all the good work we do, we then move on to do other things and we leave behind what is good. Whereas what we have to continue to do is with this strong messaging, and the private sector, the corporate sector in India has been amazing in terms of that communication. We have seen that across the country. So important for that to continue, because we cannot afford to let the good work that has happened thus far fall away.
All right. Now, Mr. Puri, there are a certain set of actions with respect to long-term impact on India's healthcare. What is it that we can do to address challenges in the short term, especially in the context of COVID?
As far as the short-term challenges are concerned, I think we have gone through this, whether it's in the first wave or second wave. And I think, as you yourself alluded to, during the period of the crisis, people were kind of woken up, pushed out of the slumber, and immediately some of the great habits came in, and it was evident from the consumption of, the hand wash products in the nation. It was obviously evident that a lot more was happening. So I think we tend to react well on crisis. Certainly, communication by all organs of society, whether it's governments, whether it's private sector, whether it's NGOs, to amplify the message, reinforce, is certainly required. That's a short term. I think that's the way we will have to deal with it.
What's your view on this, Dr. Trehan?
वो हमारी रिस्पॉन्सिबिलिटी है. हमारी रिस्पॉन्सिबिलिटी दो तरीके की है. एक तो कैसे प्रोटेक्ट किया जाए अपने आप को, और अपने आप को प्रोटेक्ट करने से आप औरों को नहीं दोगे. तो मास्किंग, डिस्टेंसिंग, वो तो जो हमने ढील दे दी थी उसके अंदर, वो जो है उसको वापस लाना है. We must follow COVID appropriate behavior. ये आपकी obligation है as a citizen. You must do something to protect the country. You can't do something कि मुझे नहीं, मेरे को नहीं परवाह, मुझे हो जाए बीमारी, मैं 5,000 और लोगों को दे दूंगा. ऐसा ठीक नहीं है. We should not tolerate that. We should be very strict. और जहाँ भी उल्लंघन हुआ वहाँ फाइन होना चाहिए.
You know, especially the pandemic actually brought this reality to the forefront. We are not a company that's directly engaged in the healthcare sector, but that's an area that we've been thinking about for some time. And we felt that given that India needs to step up investments, our investments are just 1.5 to 1.8% of GDP right now. It needs to be stepped up. So we thought we should play a role in it, and we came to the conclusion that we will approach it from a not-for-profit basis. And during the pandemic, and as part of our endeavors to help society deal with some of the challenges, and in the second wave, there were a lot of challenges to do with healthcare, the oxygen and oximeters and so on and so forth. So as we engaged with the healthcare providers, particularly in the heartland, and we also understood better the requirements in that sector and the gaps that existed. So we've said that we are actually going to take up as part of our social development initiative an integrated rural healthcare initiative, which is going to be a phygital model. We'll probably have a primary base with some primary and secondary healthcare facilities, mobile outreach unit, access to the digital platform for specialist support. So it's going to be a completely integrated program, which is right now being designed, and as parts of it are getting designed, from next quarter we'll start rolling it out. We have a team of doctors who is helping us do that. So I hope that over a period of time we will be able to make some contribution to rural healthcare, particularly in the catchment areas of our operations.
But do you have, sorry, just as an aside, were there any challenges? Because having a digital platform, rural India connectivity, did you face any challenges there, or
well, the program is going to be launched, but just to address this issue, let me give you another example. We work with Niti Aayog in 27 aspirational districts to help farmers multiply incomes. In the first wave, during the lockdown, the training had to be delivered digitally. And the numbers are not small. The farmers that we were going to train was 3.8 lakhs. So the training was delivered through 5,000 WhatsApp groups and certain special apps that were made. So, and the results were absolutely bang on as per what was envisaged. So this is just a demonstration that digital is not a challenge. I think the government's program on Digital India and creating the digital infrastructure, I think, has in fact positioned India very well for this uptake.
Well, so we have here with us a real life example of how you can dovetail various programs like, say, a Swachh Bharat as well as a Digital India. Mr. Kant, how has the pandemic helped put a mirror to India's health and hygiene standards, as well as the shortcomings that we have in these areas?
We have to remember that health of the nation is a priority. If the health of the nation is secured, the future of the nation can be secured. The health of our younger generations as well as that of our senior citizens constitutes the health of the nation. With increase in life expectancy, we have to ensure that our citizens have access to good health and well-being. The government is already working towards the improvement of public health through various initiatives. In addition to Swachh Bharat mission, the Jal Jeevan mission is part of PM's vision of providing clean tap water to every household in the country by 2024, and this will make a huge difference. Under the Jal Jeevan mission, the government has channelized its efforts to provide tap water supply to 4.5 crore households. 1 lakh villages and 50,000 gram panchayats have become Har Ghar Jal. As per National Family Health Survey, 5.9% of the population is living in households with clean drinking water, and this is a very big achievement. To ensure that the environment is clean, the government is focused on green and renewable energy, biofuels, and electric vehicles. On 75th Independence Day, the Prime Minister announced the launch of the National Hydrogen Mission with an aim to make the country a global hub for production and export of green hydrogen. With its use in sectors like fertilizer and refining industry, iron, steel industry, and automobile industry, green hydrogen can become a very big driving force for cleaner and greener future. Given India's commitment to climate goals, the National Mission on Transformative Mobility and Battery Storage aims to provide connected, congestion-free, clean, and cutting-edge mobility options to the citizens of the country. The pandemic has further posed opportunities in maintaining hygiene and use of technology. Online OPD consultations have helped senior citizens and patients maintain their personal hygiene and social distancing norms. Ayushman Bharat digital mission is focused towards simplifying accessibility and availability of health services without hindering patient safety. All these efforts define the roadmap for making India a healthier nation.
So, do you, the viewer, believe that when you are taking proper hygiene measures, you are protecting your children as well? We are conducting a tweetathon where you can join in on these issues and more while you watch this telecast. Please join with your thoughts using the hashtag Hygiene Sahi to Health Sahi. Tag Savlon India on it as well as Times Now. Coming to you, Mr. Puri, walk us through some of ITC's efforts specifically focused on improving rural healthcare.
Behavior change that has happened in the pandemic, what would have taken decades to happen has happened in weeks and months. So I think India, even rural India, is very much ready for the digital revolution. As far as the future is concerned, I think the innovation is going to be around the model that we are envisaging. That is going to be an integrated healthcare. It's going to be a lot of focus on preventive, a lot of focus also on helping people deal with the challenges and diseases they have. And it's going to be a phygital model. So for rural India, I think this whole integrated platform itself, I think, is going to be a significant innovation.
Dr. Bagai, how can we create measurable benchmarks for our progress as a country as an India-specific health and hygiene report card?
The large corporates can play a huge role with the schools, community centers, RWAs. They can take up one community center in the locality and open a simple polyclinic where these things can be measured. There are a lot of good residential colonies which don't have a nursing home or a hospital. They have small little GP outlets which are not up to the mark. So I think there has to be an interplay between the community, the local residents, each individual, the schools, the corporates, the government, to make it more holistic, more tangible to see outcomes.
This is where the private sector can play a key role, because a lot of the projects that the private sector engages in, and I've seen, say, some of the work companies do around the factories where they work, where they're pretty much the only provider of good hygiene and habit and sanitation, that they also measure outcomes all the time. So the ability to measure can happen through a measurement cycle. Often with external help, there are agencies that provide these studies, but I think everything we do needs to be measured to make sure that it is indeed having the impact we believe it is having. Government itself does these outcome measures. They don't have to be done all the time, but they should be done with reasonable periodicity and analyzed for success. And course correction also happening if it is not having the desired impact. Because why spend valuable money and effort in something which is not producing the right result?
Okay, so the most important question still remains, how do we disseminate the message that hygiene remains not just an issue of public service? It can't just be left up to the government. It has to be an individual responsibility. Let's start with you, Ms. Nana Lalkitbai.
I think a whole other area which is quite critical as we go forward on embracing these messages around health is exactly as Dr. Bagai mentioned, which is that we have to know we have to own our own health issues, but then we have to show people the way. So it's okay to know that, yes, I can solve for my health issues, but by doing what? And that's where, the washing hands, using the toilet, or just all the messaging, but connecting it back to, hey, by the way, by doing this, you save 60% of your monthly income, because that is what a rural family can lose, 60% of its income on health issues. So this is really not just about survival, it is about saving money in order to progress and spend that money on other things, because you are able to save yourself the cost and of course keep yourself healthy and well. And I think this connection as to why you're washing hands, how it saves you, has to be continuously developed because we forget it.
Mr. Kant, what do you think about the message that health and hygiene can't just remain a public service, but has to be an individual's responsibility?
See, the government is focused on improving the state of public health affairs in the country. Hygiene should form part of individual responsibility. Ensuring that the surroundings are clean, hazardous waste is disposed of properly, garbage is appropriately segregated, stagnant water is not left unattended, is part of individual consciousness and responsibilities. Individuals must take responsibility. Various communicable diseases can be avoided if personal hygiene is maintained and proper sanitation protocols are followed in households and workplaces. Spitting in public has been made an offense and is now penalized. Many municipal corporations are implementing anti-spitting and anti-littering laws through strict execution. These are nudges to ensure that hygiene becomes a part of an individual responsibility. NITI's Behavioral Insight Unit is working towards improving the quality of life of citizens through data union insights and effective communication strategies. Our young Indians of today will become our leaders of tomorrow and soon will themselves be role models for the coming generation. And therefore, inculcating this responsibility and accountability of maintaining hygiene at an individual level will improve the standard and quality of life for now and future. So I would request all individuals to maintain hygiene and to spread awareness during this period, and they should really emphasize the importance of hygiene.
Dr. Bagay, what do you think about that?
Health is an individual subject. It's not up to the state or the union government to come and help you. You have to look after yourself. Prevention, you have to move towards the aspect of prevention. Routine checks makes you prevent diseases. You have to quantify it in the sense that I very strongly feel that the next era is going to be of sensors and wearables. Give me some data and I'll give you some information. If you give me all the data, I'll give you the world. So the saying goes. Wearables and sensors is the next generation forward. Trackable devices, next generation forward. Measurable outcomes of healthcare is paramount importance. There is no point in saying, yeah, I think I feel good. I want to quantify it because it has to be measured.
Dr. Turan, over to you for that.
हमें बिल्कुल सतर्क रहना है, अपने आप को प्रोटेक्ट करना है। वो तो मैंने बता ही दिया कि ये तो सबको पता क्या करना है। भीड़ वाली जगह में नहीं जाना, मास्क पहनना, सारा टाइम घर से बाहर निकलते ही मास्क पहनो। कभी ये तो है नहीं कि लोग क्या करते हैं, बात करने के लिए मास्क उतार देते हैं। तो ये सब, ये जो रिस्पॉन्सिबिलिटी ये नहीं करनी है। और डिस्टेंस रखें। कोई जरूरत नहीं है कि आप एक के ऊपर एक चढ़ने की भीड़ में कोशिश करें। और गवर्नमेंट ने फॉर्चुनेटली इसको बहुत सीरियसली लिया है। देखो, पैनिक मैं नहीं कहता, मैं इसलिए कहता हूँ पैनिक तब होता है जब आपका संतुलन ही बिगड़ जाए। अगर जो आपका बैलेंस ठीक है और आप वरिड हो, वो बिल्कुल अप्रोप्रिएट रिस्पांस है इस वायरस के सामने।
All right, Mr. Puri, if you can give us the final word on how it can be achieved and how it is being attempted by you.
While the government programs, as we said earlier, like Swachh Bharat, etc., have helped us make tremendous progress over time, but there's lots that needs to be done. And I think each one individually has to become the fulcrum of change. Each one has to recognize that it's an individual responsibility, and we have to, reflect and really imbibe the age-old philosophy that health is wealth. If you keep yourself healthy, it's good for you. It is good for your community. It's good for your well-being. You will do well economically also. From all facets, it's going to work well for you. It's going to work well for your children. It's going to work well for future generations and the community. I think one has to come and appreciate this message and imbibe this message into our DNA. And for this, I think all of us have to work together. All sections of society, be it the private sector, the NGOs, and local bodies and governments, everybody has to come together to amplify this message and help the society orchestrate this change. And we on our part in ITC will do our bit I think Savlon also, with its mission, will continue to support and amplify this message and evolve as the societal needs evolve. And we have to be at it. It's a long journey. It's not a short one, but we have to be at it. We have to persevere till we overcome it.
Absolutely. Let's hope for the best. Thank you very much. It's been a pleasure speaking to. Now, I want to ask you, the viewer, do you agree that hygiene isn't just a public service, but an individual responsibility? The tweetathon is ongoing. It is accompanying this telecast. Please tell us what you think. Use the hashtag Hygiene Sahi to Health Sahi and tag Savlon India and Times Now. And with that, our special feature, Savlon Swasth India Mission presents Hygiene Sahi to Health Sahi, partnered by Times Network, comes to a close. We trust you found the insights shared of value. As always, feel free to join in with your thoughts by staying connected with us on social media. Use the hashtag Hygiene Sahi to Health Sahi. Thanks for watching.